Action Alliance has an agenda for my gubernatorial contest, and we call it Lagos Rebirth Agenda. The Rebirth is the code name for the project, and the H at the end of that, REBIRTH, stands for healthcare delivery. And through our design, we were able to communicate and bring in people from that sector to try to look at the sector critically before putting up what we are going to be doing. And as a result, many of the challenges that we presented today have been identified earlier before today. Unfortunately, the FYP is not well operational in Lagos, so we couldn't get so many information that are adequate enough. But from the data collected through those people in service presently in the health sector, we're able to detect that the health sector is having serious issues. And the people that are leaving the country are not leaving because they are not well paid in the real sense, but because governance in Lagos generally, or let me say in Nigeria, is not well taken care of. They are intertwined. The issue of security, the hallmark of governance is comfort, giving comfort to the citizens. Many people that are out of the country are not actually going because of the remuneration alone. And many of them are out there because they get the comfort that they desire in life. So that's where the government of Lagos State has to do more. And that is what we are bringing into our report agenda, starting from the extension of security of lives and property and the likes. By the time we bring all these things together, those people at the health sector will not be willing to leave because they are patriots just like me. They want to contribute what they have learned to better the situation of Nigerians. Unfortunately, government are not doing enough. Like I told somebody last year, January, I had an accident. I had my femur broken. I was operated in Lagos by a Nigerian doctor. And as of today, I am working with my 2 feet, not on crutches, not on walking stick. So that means they are very good enough to be able to deliver on their profession. But the government is not supportive, and that is why they are leaving. So the issue of financing is an issue. The issue of taking care of the health security from the primary, secondary to tertiary security aspect of the health sectors are not being taken care of adequately by the government because they are not actually on looking at the underlying effects of not taking care of those people. They are not directly affected. On financing, as a case study, let me quickly say four different ways have been identified to be a major ways by which they finance the health sector in Lagos. The government budget in 2020, they had a particular budget. In 2021, they reduced the percentage of the budget, which is supposed not to happen because when we have increased population, we are supposed to have increased budgetary allocations and increased infrastructures, and that is what is causing problem today in Lagos. Look at the schools. More people are being given back, more people are migrating into Lagos. There are being reduced number of schools that are not commensurate the population of Lagos, and that is what is happening to those facilities too. I will say people will tell you want to build more facilities. The facilities that are even available are not well financed by the present day government. The insurance scheme, I have an opportunity to enjoy the insurance scheme of Lagos through my usage of the facility of Lagos. So, but unfortunately, the insurance scheme is not well popularized. You have to have a kind of revolution. Before Fashola came, there is tax laws that are being operated in Lagos. But when His Excellency Babati Fashola came in to have a revolution in tax reforms, we have more money coming to Lagos State. The insurance scheme is something that is operational in Lagos, and that is a method of financing the health sector, but it's not popularized. So many people are out of the insurance scheme, and this is something we are going to be having a revolution on, so that we can have more money. donor agencies always want to support, but they have trust issues. We cannot see what happened during the COVID-19 era. We cannot see it. We are Nigerians. We knew what happened. That the money that were pumped in to that sector was not judiciously, if you're not judiciously used, the private individuals will patronize the government facilities.
Okay, thank you very much, candidate of AE.
All right.